Hello guys, welcome back to my channel. This is Dr. Congratulations, and today we want to discuss urinary tract infections, okay? But before we proceed, you guys know the drill. Please subscribe to the channel, like the video, and hit that notification bell. I want you to be informed automatically when I post the next video. All right, we proceed and discuss urinary tract infections. What are urinary tract infections, or UTIs? So these are infections that involve the passage of urine as it exits your body. All right, so we all know that urine gets made in the kidneys, then transported from the kidneys to the bladder through what we call two tubes called the ureters. And so urine is stored in the bladder, and then when you go and pass urine, it passes out through that passage called the urethra. So any infection along this path is possible, and typically UTIs involve the bladder and the urethra, so what we call the lower urinary tract. But who can get UTIs? Anybody, anyone can get UTIs. Children can get UTIs, adults can get UTIs, elderly people can get UTIs. But we know that women are by far more predisposed to getting UTIs than men are, and shortly I will explain to you why. Yes. Now, one of the most common questions we ask or we answer when patients come to the hospital, patients ask us, where did I get this infection? How did I get this infection? All right. And so, yes, how can one get a UTI? Now, the thing is, UTIs, like we said, happen much more frequently and much more commonly in women than in men. And one of the most common ways in which a woman can get UTI is by way of how she cleans her body. Okay, so while you pass stool, there is bacteria that come along from your gut and stay around the area of the anus. Now this bacteria, because of the proximity of the anus to the vaginal area where the urinary passage is, the bacteria can actually move and find their way into the urinary tract and cause infection. And this is one of the commonest ways that women actually get urinary tract infections. But then, the way a woman cleans herself. Now, it is rather more advisable that you clean from the front going to the back. But many women, you will find in the process of cleaning, are going from the back to the front. And so as you do that, you translocate, you move bacteria from the anal area closer to the urinary tract, and then they find their way into the urinary tract and actually cause infections. So for the most part, yes, that is how many urinary tract infections arise. Okay, now, are urinary tract infections sexually transmitted? No, they are not. And this is perhaps the question, one of the questions that we answer the most. You find that patients come in and ask you, now that I'm treating a UTI, does my partner need to get treated as well? Does my partner need to take the same medication? You find some are already actually on the medication because they're like, hey, I had to put my partner. Guys, UTIs are not sexually transmitted, and this should not be a reason for couples, to get into fights because of UTIs. They are not sexually transmitted. But we do know that during sexual activity, there's a lot of, activity, there's a lot of stuff happening around the vaginal area or the perineum at large, okay? And so we also know that during sexual activity, there is a possibility, much in the same way as while a woman is cleaning herself, there's a possibility that bacteria can be translocated from around the anal region into the region of the vagina, and then before you know it, you have a UTI. Yes, but then it is just the mechanism of translocating, not that the bacteria or not that the infection is being sexually transmitted from one partner to the next. So yes, it may happen in that way, but they're definitely not transmitted sexually. One other way in which women do get infections, we know, happens when you use bathrooms that are either not clean, when you use public toilets and stuff like that. There's always a possibility, okay? There's always that risk of getting exposed, especially for women. And so yes, UTIs can be transmitted in such ways. And so what are the general recommendations that you ought to practice more often to try to avoid urinary tract infections? We also know that keeping urine in the bladder for too long predisposes you to getting infections. Okay, so we advise that women should pass out urine actually more frequently. Not only women, men as well. Try as much as possible. When you feel the urge to pass urine and the bladder is full, go and empty that bladder. Okay, so as you empty the bladder more frequently, you actually lessen the chances of developing an actual urinary tract infection. And this goes along with drinking as much water as you possibly can. Why? Because you wash out the system as you drink water and pass more urine. Okay, so in that way you may prevent infections. We also advise that as much as one possibly can, after sexual intercourse, go and empty the bladder. Same mechanism, you're trying as much as possible to prevent any occurrence of a UTI. One thing we do advise for women as well is wearing underwear that does not cause you to sweat as much. Okay, so yes, and we know that cotton underwear is quite absorbent and is sometimes more preferable than other types, but yes, try to wear use underwear that prevents as much as possible sweating down there. What we also do recommend in many cases is that women should, as they clean themselves, try to go from the front to the back. I already spoke about this, rather than going from the back to the front, and that really helps quite a lot. All right, so yes, do your best to go from the front to the back, make it a routine and get used to it. That way you will prevent a lot of infections. Okay, so yes, those are some of the ways that one might possibly, and in general terms, keep your hygiene top notch. Okay, good personal hygiene, and you're less likely to encounter things like urinary tract infections. Now, what are the signs of urinary tract infections? I will give you 3 cardinal signs of urinary tract infections. 1, pain. While you're passing urine, usually towards the end of your urine stream, you feel pain, and which usually might come as a burning sensation. 2, frequency. You're passing urine much more frequently than you normally should. Okay, every few minutes you want to pass urine, you feel like passing urine. Now, the third one is urgency. Urgency is, as the word is, it is urgent that you get to the toilet, otherwise it feels like it's about to let loose. Okay, so every time you feel that you want to pass urine, it is that urgent, it is that pressing, and you find that many times, even when you get to the bathroom, there is nothing, but the urge to pass urine is there. So those 3 symptoms, frequency, pain, and urgency, definitely point towards a UTI. When you get those, try to find your way to a hospital, get tested and get treated. Now, one mistake people make is just to get on antibiotics anyhow. Not every antibiotic can treat a urinary tract infection, guys. You find patients coming in and they telling you, they've been on azithromycin, they've been on amoxicillin, they've been on amoxiclav. I mean, so many other things. Guys, not every antibiotic can treat your urinary tract infection. In fact, the standard way of management is supposed to be to do a urine culture and sensitivity. By that, we identify the exact organism that is causing the infection and which antibiotics it will respond to, and then we treat it in a targeted manner. But urine cultures and sensitivity tests take longer. You may take up to 5 days before getting results, and many times we don't have that patience. And so what we do is we use broad spectrum antibiotics many times, but you have to consult with your health worker before just getting on any antibiotic as it is. All right, that way you get your infections treated much more promptly, and you get them treated much more effectively. Well, I hope that helps. If you need more information about this stuff, hit the inbox and we'll discuss. All right.